Good afternoon, everybody. The time is noon, so we'll get started here shortly for this week's Lunchtime Live. We're going to be covering a little bit about me and just kind of approach to healthcare, a little bit about kind of the crossroads family medicine culture, which is essentially my culture and how I view healthcare. So give just a little bit of time for folks to jump on. I hope everyone's Tuesday has been going well. Don't forget to say hi when you get on so I can see that you're here. And of course, if you have any questions as we go along, pop those in the comments. If you're watching it later, please do pop the questions in there. I'll be checking back and answering any of those questions that you guys have. And let me know if you're eating lunch while you're watching this. What are you eating? What's the good stuff that everyone is having today? Or maybe the not so good stuff. Maybe it's lunch on the run or just grabbing something munchy. But let me know what you're munching on if you're eating something while you watch this. It was warming up today as I was walking in, so that was kind of nice, but I'm excited for cooler fall weather and color changes to start happening. Okay. Well, we'll go ahead and get started, dive into things. I'm ready to go. And of course, if you guys are watching this later, you can catch up. So wanted to give a little bit of background on myself. Some of you may have seen previous kind of bio videos that I've done in other chapters, so you may know some of this, but if you guys haven't seen that video or you are just kind of new to knowing me, I wanted to tell you a little bit about me. So when I was younger and thinking about careers, I started out thinking I wanted to be a teacher because I love to teach, I love kids, and so I thought I'll be a teacher. My mom was like, that's great, but maybe consider some other things. And so she was encouraging me to be a vet. And I said, well, I really do like animals, but I like people better. So how about we compromise on a doctor? And I thought I would do pediatrics because, again, I love kids, and that's what I thought I would do. I also thought about doing endocrinology, which is, as some of you may know, a doctor who specializes in diseases such as diabetes and thyroid and those sorts of things, all those hormone things. But then I landed on family medicine because I loved the variety. I also had some experiences during my rotations where I got to teach and also had some, continuity, some follow-up with patients and building that relationship, and I really loved that. So the other thing is family medicine, since we have a broad range of things, I found that I did enjoy doing procedures. Nothing huge, but little clinic procedures. I enjoy doing those. So I am full scope family medicine. I see all ages, so newborns on up to however old you might be. And then I also do women's health things. A lot of people don't think of family medicine as, seeing babies and seeing women for women's health things. But I do, so that includes things like your well woman exams and also birth control management. The other thing that I do, like I said, I enjoy procedures. So I do little lump bumps. So if you've got a little mole we need to biopsy to see if it is something to be concerned about or it's just a mole, we can do that. Or if there's a little skin cyst, I enjoy getting those out. Fan of Dr. Pimple Popper, if any of you are. We won't go too deep into that in case you are eating some lunch. I also do joint injections for arthritis, so some steroid injections or cortisone injections, as folks might know them better by. And then, just other little skin things, freezing warts or other skin things that can be frozen off. So those are some of the primary procedures that I do. So I enjoy having a wide range of patient population, and then also, you know, not just managing conditions and medications, but doing a little bit of those clinic procedures too. I am a little bit East meets West. So, you know, we talked last week in the live that I'm trained as a osteopathic physician, a DO. So I do manual manipulations. And if you want to pop back and watch that video, if you didn't get a chance to, just to get some information on what all that means, I encourage you to do that. I am supplement friendly, I would say. You know, we talked about last week, it's not something that I got a lot of training in during med school, but it's something that I'm working to educate myself in more, and how to use supplements to support health and improve health. Also, just in general, good lifestyle, right? Diet, exercise, good sleep, those sorts of things. I also have started to become a fan of essential oils and utilizing those to kind of help support health and support treatment of conditions. Another thing that I was able to get trained on actually while I was in the military is something called auricular acupuncture. So auricular meaning the ear. And I learned how to do some basic acupuncture. So there's 5 spots in the ear that can be treated with acupuncture for pain management. So that can be for arthritis. It can be, you know, in the neck, in the back, in the joints, knees, shoulders, feet. Also, if you just have kind of chronic neck or back pain from other things, we can use it for that. I've also used it for headaches. And I've also used it for things like TMJ. So that acupuncture treats pain in general. So we can always try it for a variety of things. So one day I would love to learn how to do full body acupuncture, but don't know that yet. It's a goal out there, but I do have some really good success with even just using those 5 points for pain management. So a little bit about healthcare culture and kind of how I view things in the doctor-patient relationship. That's something that I have a lot of honor for. When someone comes to me to manage their health, I take that as a huge responsibility, and I always want to do my best with that and honor the patient in that relationship. So a couple of things that I really see as key. First and foremost is communication. I'm not a mind reader. If you don't tell me, I don't know. And that feedback from the patient is huge in shaping your care plan and working to improve your health. I also want my patients, and this ties in, to be engaged with their healthcare. So I want you to bring me your questions. I want you to ask me about things that you are seeing, that you've read about, etc. I don't think a patient engaging in their healthcare by researching online is a bad thing. When patients are engaged in their healthcare, that helps me do my job better. I also look for patients to be invested, right? This is a relationship. I'm invested in your healthcare. I want you to be invested in your healthcare. So, you know, when we're trying to develop a plan for treatment, I'm going to suggest some things to try. You might have some ideas of things to try. We should try them and we should see how they work out. And then you should communicate back to me how that went. It's frustrating when a patient tries something, we come up with a treatment plan and they try it and it doesn't work, and then they don't tell me. I don't find out until maybe months later, and they come back in because things have gotten worse. I'm like, well, what happened? We had this plan. Well, I tried it and it didn't work. Well, why didn't you tell me? We could have figured something out. So just keeping me in the loop, you know, with how things are going when we try things, communicate. I view my role as, you know, advisor. So you're in the driver's seat. You get to make the choices as the patient. This is your health. It's not my health. It's your health. But my goal is to make recommendations. I'm here to advise you on what would be the best treatment plan or treatment plans, because oftentimes there's more than one option. But, you know, it's up to the patient. We get only a portion of your day and time together, And then the rest of it is on to you to engage in that plan, activate that plan, carry out that plan, and let me know how things are going so I can advise, instruct, educate for the next steps. Part of things that I really want to increase in, moving forward with this new practice is really a focus on prevention. So that has been a huge passion of mine. And sometimes I feel like there's not enough time in, traditional medicine, traditional clinic to be able to do that. So direct primary care, I feel like, allows more space to really hone in on prevention. So even before problems start or when they're very small, how do we nip them in the bud? How do we, work on improving diet, lifestyle, sleep, exercise, etc., before things become an issue. So last week we kind of talked about the body has that ability to heal, but it can get overwhelmed, right? It can have too much of a load that it just can't compensate. It can't fix that or repair that. So how do we assess trouble spots before they cause disease or health issues? Also included in that is cancer screenings, making sure that patients are up to date on that. And I think most people are pretty aware of what those are, but assessing a patient for their risk, making sure we're doing things appropriately and on time, and talking about options for that. And then just making sure we're looking for development of chronic diseases, especially if there are risk factors for them to develop. So whether that's diabetes, heart disease, kidney disease, all the other ones. The other thing is, OMT, I really do feel like is foundational, and I've had some really great experiences with treating patients with OMT and broadening that out to really treat a variety of conditions. So using those osteopathic manipulations and treatments as a part of treatment plans is an area I plan to expand and develop as this clinic grows and goes on. So not just addressing a patient's neck pain or back pain, but really kind of getting into, well, if there's issues with the digestive tract, are there things that we can address with manual manipulations to help improve that? There's a lot of nerves in the digestive tract. So is there something that we can free up and improve that's maybe been hindered by kind of some structural issues, tissue layers that have tension in them that are impeding how things are functioning? So really incorporating that into a patient's care plan is going to be a goal moving forward. Now, obviously, again, patients in the driver's seat. If they don't feel that that's a good fit for them or that they want to incorporate that, we don't have to. That's kind of the benefit of my background and training, is that we can do things as traditional in medicine as we want, or we can start to explore some other options and look at other ways of treating and managing things. And then with being a direct primary care, and, I've had a video and a chat as well about what direct primary care is. So go back through the archives if you haven't seen that and you want to get some more information. But the goal of this clinic is to really just be transparent, to be adaptable, and to really be simplified. I don't want healthcare to be complicated for my patients. I want it to be adaptable to your needs and kind of flexible, and along with my lifestyle, being flexible and adaptable, so that, I can do community engagement and volunteer activities and things like that are also part of, what drives me and fills up my cup. So direct primary care is great because, it is flexible. I also like the fact that it simplifies things when it comes to cost. There's not going to be surprise bills from our clinic. We're going to tell you what things cost ahead of time. You know what your membership costs. If there's something that is an additional fee, you're going to know what that is. We'll tell you up front, hey, this is what the cost will be. And you can just pay that at that time. And there's no bills coming out, a month later or more that you weren't expecting. We're really the goal is to keep administration layers simple, right? So direct access between you and I. There's not going to be a bunch of people between you and I if you're trying to communicate something to me. And that's really what I want. I don't want to play the telephone game where the message got passed through 2 or 3 different people by the time it got to me, and then I'm trying to really figure out what the patient needs. I want to hear it straight from the patient. What's going on? What's the issue, and what do we need to do? And then, again, with keeping things simplified and flexible, is avoiding that overscheduling or overbooking. So, right now my clinic's only open 30 days out for appointments, and that just kind of helps keep that simplified, not overbooking. We're not, loading up way in advance. It keeps our appointments open for those same day or next day appointments that we need if there's urgent issues. So, okay, well, that's what I had for you today. I hope that helped maybe clarify some things about, where I'm coming from, what my background has been, and kind of what my goals are for moving forward, and, what it would be like if you are working with me in a doctor-patient relationship. So if you have questions, please ask. If you don't feel comfortable putting in the comments, feel free to direct message me with those, or call. Someone had asked last week if we were still doing like the meet and greet enrollment appointments. The answer is yes, 100%. Definitely continuing with those appointments. So if you want to have a face-to-face conversation about Crossroads Family Medicine, about, my care as a physician, feel free to schedule that. There's no obligation. It's simply a question and answer informational meeting. So I'm happy to sit down and chat with you about, the type of care you could expect to receive here. And if it works for you, it works for you. And I'm happy to have you join our clinic. All right, you guys, wishing you a fantastic rest of your week, and we'll see you next week.